Hi guys, this is RX Health Advice from a person on the other side of the pharmacy counter. I decided that I am going to be starting a new segment called This Week in Pharmacy. And basically what I'm going to do is I'm just going to list I'm going to try to do 5, but a couple of stories or news reports that are important to pretty much everybody in the healthcare profession that also will affect a lot of patients or that patients might find interesting to be aware of. So I'm going to start doing that. So let's start with today. This Week in Pharmacy. It's found that 2% of all children in the foster care system are taking powerful antipsychotic medications that are really intended for use in bipolar disorder or schizophrenia. The New York Times reported a study that stated that children in this setting are being prescribed these drugs as frequently as some of the children in the Medicaid system that are extremely mentally disabled. The study also investigated the frequency with which children are being prescribed more than one of these powerful antipsychotics at the same time. So recently it was found that Colchicine, which has been useful in the treatment of gout for ages, is now being shown to be useful in the prevention of postoperative atrial fibrillation. So basically arrhythmias after heart surgery. It was shown in one study that the amount of postoperative atrial fibrillation was reduced by up to 42.1% compared to nothing or a placebo. So that's interesting. So recently Europe announced that they were going to start putting a lot of funds into the research for antibiotics to combat superbugs. It was reported in the recent past that antimicrobial or antibiotic resistance is one of the top 3 health threats in the world. And it's only becoming increasingly more so as time goes on. So Europe is planning to really delve into this and within the next 5 years try to develop some antibiotics that can combat these superbugs. A recent study that was published linked up the long-term use of older anticonvulsants or anti-seizure drugs such as phenytoin or dilantin with the acceleration of atherosclerosis. Say that 5 times fast. Atherosclerosis. I can never say it. Anyway, it was found that long-term use of anticonvulsants is linked to the acceleration of atherosclerosis. And it was found that the longer that the patient was on the medication, the more likely they were to be at risk for this acceleration. One thing that was interesting, though, was that the anticonvulsant Lamictal, or lamotrigine, was not found to have this correlation. So that gives physicians some flexibility if their patient is at risk for developing atherosclerosis and they have epilepsy. And the last story is that it's been found that the multiple drug shortages that have been going on for the past few years, it's really starting to take a toll on a lot of different healthcare facilities, especially now that many cancer drugs are being brought into this. It's becoming more and more concerning as time goes on, and it was found in a recent report that the amount of drug shortages since 2005 has quadrupled, which is absolutely ridiculous. So a lot of pharmacies and hospitals are trying to stock up on as many drugs as they can, since they never know which drug is going to be shorted next. Okay, so that's my This Week in Pharmacy. If you guys have any questions about any of these stories that I just told you about, or if you'd like to hear about something else, Let me know, leave me a comment, or drop me a message, and I will see you guys next week for This Week in Pharmacy.